Efficacy of an adjuvanted herpes zoster subunit vaccine in older adults. Herpes zoster, or shingles, results from the reactivation of latent varicella zoster virus in the dorsal root or cranial nerve ganglia, usually decades after primary infection. Applications in medicine. Recombinant subunit vaccines are an alternative to live-attenuated vaccines against herpes zoster, like Zostavac from Merck, containing the Oca BCB strain. Pros: reduces risk of herpes zoster, may be suitable for persons with immunosuppression, no safety concerns have been identified, no efficacy variation in various age groups. Cons: pain at the injection site and myalgia, not fully tested. In Ecuador, herpes zoster affects people, especially the ones who are 70 years old or older. Antivirals are mainly used. Conclusion: the HZSU vaccine significantly reduced the risk of herpes zoster, and overall efficacy was well preserved among participants who were 70 years of age or older. Videos. Herpes zoster.
Shingles, also called herpes zoster, is a painful blistering rash caused by one of the herpes viruses, but not the one everyone's afraid of. And while it's contagious, you'll be surprised to find out what you can catch from it. Hello, I'm Dr. Neil Schultz, and welcome to Derm TV. Shingles used to be an older person's disease, but we see more and more of it today in young adults, starting even in the late 20s. It's caused by the chickenpox virus, whose medical name is varicella zoster virus. And while it's one of the 4 viruses in the herpes family of viruses, it has nothing to do with the herpes simplex virus, which is the one that causes both oral and dreaded genital herpes. In medicine, shingles is considered to be one of the great imposters, because the initial symptom before the rash comes out is pain for a few days. And that pain can be severe, and even imitate the pain of a heart attack, kidney stones, and even appendicitis. It's usually a shooting or radiating pain in the area where the rash comes out. Okay, but you can't catch shingles from another person. Shingles is a reactivation of your own dormant chickenpox virus that's been harmlessly sleeping in one of your nerves for decades, ever since you had chickenpox as a kid.
Causes of shingles, symptoms, and treatment for shingles.
Shingles is a skin rash caused by varicella zoster virus, the same virus that causes chickenpox. It is a painful skin rash, usually with vesicles, and occurs in a cluster or band localized to a small area of the body. Shingles occurs when the virus that causes chickenpox becomes reactivated. After one recovers from chickenpox, the causative virus becomes dormant in the nerve roots. In some people, it remains dormant forever, while in others, the virus gets activated if the person becomes stressed or has a weaker immune system. In few
Shingles, herpes zoster diagnosis and overview.
Hello, and welcome back to Online Derm Clinic. I'm Dr. Chris Schock. Today I'm going to speak about herpes zoster, also known as shingles, a very common reactivation of the chickenpox virus. Let's talk about herpes zoster or shingles. Well, here you can see pictured an example of shingles. Well, just what is it? Well, what happens is that when we're usually children, we contract chickenpox or the varicella zoster virus. Well, this virus lives with us for our lifetime. Once we have it, it lives in a region of the nerve called the dorsal root ganglion. Well, reactivation of the chickenpox virus causes shingles.
Herpes zoster ophthalmicus.
This is Dr. Paul. Thank you very much for tuning to our channel today. This evening I want to talk a few minutes about herpes zoster ophthalmicus, basically shingles affecting the eyes. Herpes zoster ophthalmicus is basically when the herpes zoster involves the ophthalmic division of the trigeminal nerve. So the ophthalmic branch of the trigeminal nerve is involved, and it presents with malaise, fever, and sometimes headache. And also periorbital burning. These patients come with that burning sensation and itching. And these symptoms, they precede the eruption by 1 or 2 days. So first these symptoms comes and then the rash comes. And you need to remember how the rash evolves. It starts as a vesicular rash, then it becomes pustular, and then becomes crusting.
Animated Medical and Health Dictionary, Herpes zoster.
Herpes zoster. Herpes zoster is an infection of the nerves supplying certain areas of the skin, caused by varicella zoster virus, which also causes chickenpox. After an episode of chickenpox, the virus can remain dormant in nerve cells for several years and re-emerge as shingles. Symptoms include itching, tingling, pain, and rash that turns into blisters, which gradually crust over, leaving scars, usually on one side of the body.